And welcome back to AM Break. I am Audra, and we are here in partnership with North Florida Women's Care to discuss some special issues that women at home need to know about. I have Dr. Andrea Frau, who is the Chief Medical Officer for Tallahassee Memorial Hospital, and I'm also joined by Dr. Heather Flynn that works with Florida State University. So ladies, welcome.
Thank you for
welcome
having
to the
us.
show. Now, we talked a little bit about what we're going to address today, but can you kind of brief us into, we're talking about World Maternal Mental Health Day, which is today. That's amazing, okay?
Right.
And there's a bigger cause that is National Maternal Mental Health Month. So what does that mean for people at home who are maybe not sure about maternal mental health?
It's a great question. I'm really pleased that the world and the United States and Florida in particular has stepped up to shed light on something that even 10, 20 years ago we weren't really talking about at all. So maternal mental health really is a way to bring about awareness to any mental health or substance abuse condition that occurs around the time of having a child. So it could be during pregnancy and the postpartum period and well into raising small kids. And mental health like depression and anxiety are highly debilitating conditions that don't really routinely get treated or addressed.
Definitely. And Dr. Frau, we were talking earlier, a lot of times women are afraid of complications with delivering and all these kind of issues that may arise. But what do you think is the number one issue that actually comes with childbirth?
It's basically 1 in 7 women, or over 400,000 women in total, actually experience perinatal or depression around their pregnancy, and this can happen up until 12 months after delivery. And so as much as complications such as bleeding and contribute to, which is hemorrhage, or contribute to death or mortality for women, suicide, unfortunately, and overdose-related illnesses also contribute to that. So we need to pay attention and have some support for our moms and families.
Definitely. And so as a doctor, you're thinking, I'm looking at you, I'm examining you, and let's say you have a patient who you figure out, you need some resources. What are resources and places for people to go if they feel like, maybe I do need some help, I need to reach out? How would you guide them? Where would you steer them?
Absolutely. In our community right now, we are trying to engage the physicians as well as the mental health providers and partnering to be able to help these families. One crucial step is to be able to identify the patients in your office. And that involves using a skilled and tool to screen for depression and anxiety. Sometimes these tools only take 5 to 10 minutes, and once your office staff is fully trained, then you can actually identify these patients and then partner with mental health providers to get them care. So that is one of the biggest tasks that we are facing right now and trying to get that organized.
Definitely. And Dr. Flynn, you can definitely speak to the resources that may be available or what you can do in tandem in working with North Florida Women's Care.
Yeah, well, as Dr. Prowse said, it starts with the screening. So we're very happy that North Florida Women's Care and other OB-GYN settings across the U.S. have begun to use screening tools just like they would screen for gestational diabetes or high blood pressure in pregnancy or some of those other dangerous medical conditions. So it starts with the screening, but as she mentioned, there really needs to be a linkage to a care provider, to a well-trained care provider. And so what we've been doing here in Leon County is identifying mental health providers who are out there who self-identify as feeling comfortable treating maternal mental health. And we put together a resource guide, which we've made available online to anybody who would be interested in finding a provider. But it really starts with the physician giving some education about mental health, explaining to the woman why it's important to get that treatment, and then making that referral to somebody they know is out there.
And just to speak to how important this is in Tallahassee and the state of Florida, what are some upcoming things that are happening to raise more awareness of maternal mental health?
May is Maternal Mental Health Month in Florida. And here in Leon County, both the county and city level, we have the second week of May designated as Maternal Mental Health Week. So we have some outreach that we're doing, and your show is a really important part of getting the word out. But we're also doing some conversations with different communities to learn from community members what would help them to feel more comfortable seeking services for mental health, because the stigma still exists.
Definitely.
So we're starting with awareness and destigmatizing, and our next step really is to strengthen the capacity of the community mental health providers to do this kind of specialized treatment for women during the transition to having a baby.
And that's great. And I can imagine sometimes the hardest step is just admitting. that there's an issue. You know, we're power women. We can handle this. We have this. And so
Right.
what are some suggestions you have for people who may be feeling, you know, maybe there's something, or maybe a family member recognizes some issues, or someone in their family needs support?
Absolutely. Throughout their prenatal care for patients, we start screening actually at the first visit and then actually rescreen throughout the pregnancy and postpartum, just to let them know they're not alone and that there are resources available. The advocacy that surrounds us, we had the bringing postpartum depression out of the Darkness Act, which helps advocate for women. So making it the more aware that the community is, then patients are more apt to admit that they are having some struggles.
Well, thank you so much for all of these resources and ideas that you have shared with the viewers at home. And we think that working together, we really can tackle and bring awareness of maternal mental health. Stick with us. We'll be right back.